Hello friends, back with another session here. Here I'll discuss in reference to the NBE-DGO practical, and from now onwards I'll be discussing the NBE-DGO theory paper-wise solution. So if you are finding it helpful, do like and share this video. So I'm starting with the video. The NBE-DGO practical will be of total 300 of marks and no OSCE pattern. So you heard it right. There is no OSCE pattern in the NBE-DGO practical examination like the DNB practicals. But you have to score up to 50% marks to pass the exam. So you have to score 150 or above it. Okay, so there will be clinical cases which will be of 200 marks, and total you will get 4 cases, 2 for OBS and 2 for gynae. So mostly like you will get two long cases or maybe one long one short case for both obs and gynae. Okay, like anemia you will get, and other one you will get is twin pregnancy, or you will get diabetes mellitus or hypertension in pregnancy, like this. In gynae cases you will get like AUB, or along with that some vaginal discharge problem, PID, or candidiasis, you will get fibroid. So this type of combinations you will mostly get, or maybe sometimes uterine prolapse, along with that you will get ovarian masses, adnexal masses type of things. Okay, so the both the clinical cases will be total of 200 marks, obs for 100 and gynae for 100. So this is a major portion where you have to score, or you have to prepare well to pass the exam. Okay, then the second thing is ward round. Ward round will consist of 4 cases, each of 10 marks, like 40 marks each. There the examiner will tell the PG or a resident to describe a case to you, and then you have to ask questions on the behalf of the scenario. Like they'll present you a case of post-op day 1 of cesarean, or post-op day 1 of suppose ectopic pregnancy or hysterectomies. Then you have to ask questions based on that scenarios or based on that cases. After that the examiner will ask you the questions. Table vivas will consist of 60 marks, which will include specimen, maternal pelvis and fetal skull, contraceptives, drugs, instruments, CTG, partograph, HSG, USG images. I will be describing all here. Like instruments, mainly they'll ask name, uses, disadvantage, limitations, holding method of that instrument, method of sterilization. Do not miss forceps, vacuum, laparoscopic and hysteroscopic devices, and pap smear and liquid based cytology, spatula things, and brush. So specimen will include, will ask you, they'll ask you question like identify the specimen, identify the features, by which features you are identifying the specimen, and incidence of the problem, sign and symptoms, prevention and management. So on drugs they'll ask you name, the doses of the drug, and the use. Pelvis and skull. So on the pelvis they'll ask inlet, pelvic brim, conjugate, ischial spine, and its importance, waist space of Morris. Most important pelvimetry, they'll definitely ask you 100%. So do not forget to read this. Different type of pelvis, especially Roberts and Neglis pelvis, you have to learn this. Fetal skull, sutures and fontanelles, diameters, both anteroposterior and transverse diameter, difference between caput and cephalohematoma, molding and its grading, and deep transverse arrest they can ask. Okay, so contraceptive is centroman, Cerazette, Minipil, unwanted 72. You have to learn Pearl Index, indication and contraindication of all contraceptives, WHO eligibility criteria, barrier methods, failure rates, non contraceptive benefits, intrauterine devices, technique of insertion, missing thread, pregnancy with IUD, indication of removal, when you will remove this IUDs, and permanent methods. You should learn this, okay? And implants and all, do not forget that also. Then CTG, partograph, HSG, and USG images that you have to see for the table vivas. That are CTG, they'll ask to identify like acceleration, deceleration, fetal heart rate. You have to, you should know that, and sinusoidal pattern, normal CTG, reactive versus non-reactive NST. On HST, they'll ask use cannula, which cannula you're using, patency of the tubes, abnormality, diagnosis like uniconnovate, biconnovate, anything. USG, they'll ask interpretation, diagnosis, and management. Mostly they'll ask H mole, snowstorm appearance. Partograph, the abnormality, WHO labor care guide difference with the modified WHO partogram, and respectful maternity care. Like in the labor care guide, the first column is of the CPOP, that is companionship. You should know that thing. Respectful maternity care will cover that companionship. So you should know that question. So showcase your talent, and all the best for your practical examination. In case of any doubt, you can comment here. I'll be happy to answer. Okay, all the best.